Everyone. Welcome to our annual training on claims management, drug-free workplace, and DMP training. My name is Michael Casey with the County Employer Group and NDACo. I am your CEG Underwriting and Loss Control Manager. I'd like to thank you all for taking the time to attend our year-end annual training. This is a mandatory training that we have to conduct annually on behalf of our insurance company, WSI, as a part of our WSI programs. There is really no way but to go through this and talk about the importance of communication and getting the information out to everybody. We probably have people that have been with the county for years that have been through this before. And then we probably also have new people that are out here. So please understand that this training has to be done and the information provided is for your benefit and the information is in your hands so you know what to do in case something happens along the way. So we're going to jump right into our first slide, which is a designated medical provider. The designated medical provider is a clinic, hospital, doctor, etc., that has been selected by your employer to treat work-related injuries and illnesses. An employee injured or made ill on the job must seek treatment from an employer's DMP. All employers must have at least one DMP registered on their form, but they may have more than one. Some smaller communities may only have one, where larger communities like Fargo, Bismarck may have 15, 16 DMPs on there. Employees may add additional DMPs to their employer's DMP form. They may add those additional DMPs at any time throughout the year. However, the employees may only seek treatment from DMP designated at the time of injury or illness. Okay, what that means is you go out and you hurt your back and you go to the chiropractor and you haven't put that additional DMP on your DMP form ahead of time, WSI is probably not going to cover that claim based on the fact that you did not have that chiropractor, as an example, on your form ahead of time before you went to go see them. So make sure you have an understanding of this designated provider form. This is a copy of the designated provider form. Your county or zone will have their DMC selections pre-filled in the very top. The third selection is where an employee may add additional DMPs, say a chiropractor or an optometrist, onto your form, and you do that ahead of time, as I said in the last slide. Only those designated medical provider forms in effect at the time of the injury are valid. Not seeking treatment at a DMP may result in the denial of a claim. Emergency treatment is exempt from the DMP requirement. So if you have to go to the emergency room, that is an exempt scenario that overrides your DMP form. Okay, we get into situations where down the road we have an employee that went through the training. 6 months from now, they get injured. They go and see somebody that is not on their individual designated medical provider selection form, and it goes to WSI. They're not on there, so they deny the claim, and the employee comes back and says, I didn't know we were supposed to go to a particular provider. We're able to pull the form and show that, hey, one, we went through the training, and two, you signed off on your form for the year that talked about the designated medical providers. So please understand this particular section of the training and what you need to do. If you don't know, please talk to your supervisor or your risk manager, and they will be able to help you with this form and make sure you've got it filled out correctly. Drug-free workplace policy. Each employer has a written drug-free workplace policy. Supervisors must be familiar with their role in this policy. In general, supervisors should pay attention to the warning signs of drug or alcohol abuse, enforce the employer's policy against substance abuse, require consistent work and standards of all employees, refuse to cover up or accept excuses or ignore the issue. I think ignoring the issue is probably one of the bigger things because it may be a friend of ours that might be having some trouble and we know about it and we're just going to ignore the issue and hope it gets better, which is never the right thing to do and never a good idea. So take steps to help your employees. Reasonable suspicion. All supervisors should receive reasonable suspicion training with periodic refresher training. DOT supervisors are required by federal law to have 120 minutes of reasonable suspicious training at a suggested level interval of every 2 years. Observe and document employee signs and behaviors that are consistent with drug and alcohol abuse. Know who and how to contact a testing provider. Most counties are using a third party as their testing provider. Make sure we know who that is and how to contact them. Instruct an employee to take a reasonable suspicion drug and/or alcohol test, and be familiar with your employer's policies regarding refusals. A refusal equals a positive test. It should be in your written policy. Take action dependent on the outcome of the testing. In other words, follow your written policy. Post-accident and injury testing. If an accident involves a motor vehicle or heavy equipment, the employee should be required to submit to drug and alcohol testing every time. If it is reasonable to assume that impairment contributed to the accident, the employee should be required to submit to drug and alcohol testing every time. Know who and how to contact a testing provider. And as I mentioned on the last sighting, most counties or most employers use a third party. Make sure we know how to contact that third party when we get into that situation. Take action depending upon the outcome of that testing. In other words, refer back to your written policy. As an employee, you also need to know all of the things about the drug-free workplace policy and post-accident injury testing. So if you are out there and you are in an accident, just know ahead of time that the company is going to have you take a drug and alcohol test just to make sure that everything is okay. So it's no surprise to anybody when something like this happens. Alcohol use and abuse in the state of North Dakota. North Dakota has consistently ranked among the states with highest rate for binge drinking. A lot of it that we hear about is per capita. We're number 1 or number 2 in the nation. Some of that is we live in a smaller per capita state, but that does not diffuse the fact that it is a problem. Binge drinking is defined as 4 or 5 drinks for a woman and 5 or more drinks for a man in a single occasion. 21% of North Dakota adults are estimated to have engaged in binge drinking in any 30-day period. And 47% of all traffic fatalities in the state involve alcohol. So those numbers alone should make us all aware that alcohol abuse and use in North Dakota is a big deal. Now, we've known this for years, and so as employees and employers know that this is something that is on the radar. Drug and alcohol testing. Alcohol in 2024, county employees tested positive for alcohol of 0.02 or greater 3 times. One was a non-DOT reasonable suspicion test, one was a DOT post-accident test, and one was a DOT reasonable suspicion test. Drug testing, other. We had 6 other positive tests in the state, 2 DOT positives, both for marijuana. 1 was pre-employment, 1 was random. 4 non-DOT positives, all for marijuana. 2 were pre-employment, 1 was random, and 1 was reasonable suspicion. We also had 1 non-DOT refusal to test, which, as I mentioned before, a refusal equals a positive. Workplace unintentional overdose deaths from non-medical use of drugs or alcohol have increased by 540% since 2011. Those numbers alone on a 540% increase since 2011 tell us that is a big problem in the workplace. Please know this as an employee and as an employer, that alcohol and drugs are something that we are really on the lookout for. Help our employees. Help your employees. Each employer has an employee assistant program. This is a listing of your county and who that employer assistant program is as a designee in your county. This should be up in your county, in every county building, for you to be able to go and take a look at. This is a reference for you to help you as an employee or an employer help your employees in case they get into trouble. Be prepared to refer an employee to the EAP provider for help. Know how to contact the EAP provider. It is all private and confidential. So if you are somebody that is dealing with something, you're able to go to one of these assistant programs, and it is all private and confidential. This should be posted in all county buildings. Injury, accident, incident reporting. Accident investigations. Okay. Injury, incident reporting. When am I covered under the workers' compensation insurance? Anytime you are conducting work in the course of your employment, doing something that your employer requires you to do. Okay. You're not covered if you leave the premises on break or if you leave the premises on personal reasons. So you wouldn't be covered there. Incidents in the workplace. Anytime an employee has an accident or an exposure, chemical, bloodborne pathogen, any kind of an incident, but it's not bad enough to go to the doctor, we need you to report this to WSI within 24 hours so that we can document that something has happened to you in the workplace. If it's an incident and you are not going to go to the doctor, you need to contact your supervisor and your risk manager, and they can fill out an incident report for you. This is something that does not take very long. Supervisor or a risk manager can fill out an incident report for you in probably a couple minutes online. And this is very, very important to protect you as an employee and also protect the county. Okay. If we don't fill out an incident report, and let's say we have a cut on our finger and everything's fine, but about 5-6 days later, we've got some infection, we've got some green pus that's coming out of our finger, and now we say, okay, I better go into the doctor because this has kind of got infected and it's kind of bad. So you go into the doctor. Now the emphasis is on you to prove that this happened when it was on the workforce, on the job site, and WSI could very easily stop and say, well, we have no idea that you got hurt at work. It could have happened when you got home that night. You're mowing the lawn, you're working in the yard. Something happened that did not happen while you were at work. So filling out the incident report is for your safety as an employee. Even if you aren't going to go to the doctor, that is documented there in case something happens down the road. Then you need to go to the doctor. We have that. Okay. If it's an injury, you're hurt or ill on the job, seeking medical attention right away, we have to fill out a FROI, or a first responsive injury. Okay. And once again, your risk manager or your supervisor can go in and take care of that for you. And we have to have that done within 24 hours. Okay. If we don't have it done within 24 hours, WSI can come back and fine us and fine the county up to and including $350. And it's just a situation that we don't want to have happen, because if we're doing everything correctly, once we have a claim started, that claim will flow a lot easier through WSI if we have filled out the proper documentation of something happened to us, whether it was an incident or an injury. Okay. Once we have an injury and we go to the doctor, we have 4 days to fill out an accident investigation. Okay. Now, initially that sounds kind of bad. We're doing an accident investigation. It's not bad. It's for the county and for the employee. As that claim goes through, everything should be documented on what happened and how it happened. And it's just letting WSI know that, hey, this was a workforce injury, and it helps everything go more smoothly as we move through the process of getting you healthy and getting you back to work. Okay? Not reporting puts you in jeopardy. Okay? We have an incident report. That incident report does not affect the county in any way whatsoever. Okay? WSI is a proponent of us telling our supervisor or our risk manager every time something happens. Okay? And there's nothing too small that we should not report as something happening. What am I covered? Anytime you are conducting work in the course of your employment doing something your employer requires. I covered that a little bit earlier. Why document? You document for you and for the county. The county is not penalized for incident reports, and nothing, once again, is too minor to report as an incident. Follow your county's procedures and make sure you contact your supervisor and your risk manager. Okay, doctor's report of injury, capable assessment report. Okay, once we go into the doctor is going to start working with you, and he or she will fill out a capable assessment report. That report is telling your employer what you're capable of doing if you're able to return to work. Okay? Don't leave the doctor's office without this report. It determines your medical capabilities or restrictions that you currently have. Doctors normally do their paperwork after their shift or at night. We can't let you come back to work without this form and know what your restrictions are. You may lose time or have to use vacation time if you don't come back with the capability assessment report. So please, while you're in with the doctor, if you are there on a work injury, please let the doctor know that you need the capability assessment report to take with you back to work. They will fill that out for you before you leave. Okay? You go to the doctor 2-3 times, you need a new capability assessment report every time after every doctor visit. You can take the form with you, hand the form to the doctor at the appointment, and have them fill it out. Okay, we have a transitional work program. What is this? It's the process through which injured employees are brought back to work as quickly and safely as possible in predefined temporary assignments. CEG has the most comprehensive return to work program in the state, and a lot of businesses out there are trying to follow the program that CEG has set up as far as transitional work and the program that we have set up. So we have jobs already set up for all kinds of different injuries at all of our locations that a person can go in and do to get you back to work. We work directly with the doctor, present them with the potential work options, and the doctor will sign off. It is proven that employees heal quicker as work is therapy for us all. You might be returned back within your own department. You might return back to work within another department, and sometimes you might be returned back even within another county, depending on the situation. I think that's a rare scenario, but it could be a possibility. So, why get back to work? What are the benefits of getting back to work on time? Well, you maintain their earnings potential. If you aren't back to work, WSI is going to give you 66 2/3 with a benefit cap. Okay. When you get back to work, you're going to maintain your hourly wage that you make and you won't lose any ground. So you'll be making full wages. You'll maintain your health insurance and other benefits, and you'll maintain job security, maintain your retirement plans, and you might gain additional knowledge by learning new on-the-job skills during your transitional work period. But the emphasis is to try to get you back to work so you're making your full wages, you're not losing out on any of the benefits that you have, and getting you back to work in your normal job position as soon as we can. Okay? We want to be proactive versus reactive. Use the personal protective equipment you've been provided with. If you don't have personal protective equipment you think you need, don't be afraid to ask. If you have it, please use it. I have been to some sites where there's been accidents, and I can tell you that a lot of times it is people are not using the safety equipment that they're provided with, whether it's a helmet, seatbelt, gloves, eye protection. The list goes up and down for each job. We want to make sure that we have the protective PPE and we're actually using it. Very important. Okay, we'll go through some of the PPE that is out there. We have a program here that once a year we try to help the counties with our safety and ergonomic initiative. And these are some of the things that we help them with. Jackets, vests, sheriff vests, hooded fall type jackets. We only buy class 3 reflective safety vests or jackets as they are the most reflective and offer our employees, our county employees, the most safety that we can out there. If you're looking at vests, we want to size up 1 or 2 sizes for winter use if you don't have a class 3 winter jacket. The winter jacket, you normal size it. Okay. Sheriff's Department, sheriffs are usually wearing chest protection underneath. So they usually go up a size of what their normal size is. So these are some photos of some of the things that we have purchased in the past. We've got some eye protection. We've got gloves, electrical gloves, anti-vibration gloves. We've got protective non-stick gloves, face protection, something over a mask for our nose and mouth in case we get into a situation where we don't want to be breathing anything in. And those type of things go from very protective to just real normal protection as far as gloves, face mask, and those type of things go. Okay, ice cleats. Ice cleats are very important for us in the state of North Dakota. We've got the yak track up there that kind of goes over your entire shoe. A lot of people wear those if they're outside for a long, long period of time. People wear them when they go out walking or running on their personal use. What we see more people using now at the county level is the ice cleat on the bottom that just slides to the top of your boot or the side of your boot. And then when you step outside, you just lift up your shoe, put the spikes on the bottom of your foot on both feet, and then off you go walking. Once you get to your car, you can sit down, just slide them back to the side or the top of your shoe. It won't tear up anything as far as the carpet or anything in your car. But the ice cleats are something that we're really, really pushing. And the reason that we're pushing is because 40% of our claims in the CEG are now from slip, trips, and falls on ice or snow. Okay. Being in North Dakota, we have a little longer winters than most people do. So we're dealing with the slip, trips, and falls a little more than most people. So we are really pushing these. And we can buy these for your counties, but we need to know if you need them, how many you need, and we can help either help the counties purchase or we can help them through the initiative. Okay. During our conference this year, we gave out almost 400 pairs of ice cleats. to attendees to bring back to the county to give to our employees. So this is something that we're really serious about. If we could cut our slip, trips, and falls in half, we could put $400,000 back into our county's pockets in less claims. So very, very important that we try to do our best of decreasing our slip, trips, and falls on an annual basis. Okay. Law enforcement and presumption clause. Presumption clause is a legal concept in workers' compensation that presumes a disease or injury is work-related for certain employees in specific jobs. In North Dakota, there is a presumption clause for full-time LPOs and FFs. Heart attack, stroke, vascular rupture, or other similar cardiac event occurs no later than 48 hours after the officer engaged and participated in the activity. We're looking at 5 years of continuous service, may include outside of the state, and has passed a medical examination which fails to reveal evidence of such a condition. Okay, so basically what this is stating that is if an officer or a firefighter has a heart attack or one of the related things happen to them on or off the job, it is assumed to have happened and presumed to have happened while they're working because of their job working in a highly stressful environment. The presumption clause comes into play. Okay, the presumption clause may be rebutted by clear and convincing evidence that the condition or impairment is not work-related. So the presumption clause is very important for those people that it affects. Okay. Want to just let you know that all the information that we covered, once again, is for the employees' information so they know what to do if they do get into a situation where they need to go to the doctor. They know what's going to happen if something happens to them at work and they wreck a vehicle. Their DMP forms, claims management type of stuff. If you're wearing your protective PPE equipment, very important that you're using what's provided to you. Very important that you ask if you don't feel that you have it. Once again, the entire training is for you, the employee, to be protected and know and have the information. And it's also for the county, so the county knows what to do and they know that they need to communicate with their employees. Okay? If you have any questions or you need any help along the way, really with anything, please ask your risk manager or your supervisor, or you can contact either myself or Jennifer Mormon or Patrick Engelhardt, who is our safety manager. Jennifer Mormon is our claims manager. And all the information is on the screen. Any of us can help you if you need any help. Okay? If you happen to get into an accident or an incident and you're working either weekend shifts or night shifts, we can wait until the next day to do that, or we can wait until Monday to get all that paperwork and everything filled out if it happens on a weekend. So please, once again, if you have any questions, please ask your risk manager or your supervisor, or you can contact any one of us. I'd like to thank you for taking the training for this annual training for the year. Everyone have a good rest of the year, and I appreciate your time and your work. Thank you.